Well, hello all and happy new year. It is great to be back with you on the Dispatch. I'm excited to bring for you a special request from Andrew DiBartolo, the man himself. He had one parting request for me that because of the important content of the interview that he had with Dr. Peter McCullough, he wanted me to share it with you in its entirety in front of the paywall. So all our other interviews that we had with our many special guests, you'll have to go over to ldcanada.substack.com and you'll have to become a paid subscriber to see the full-length interview with men like Dr. Joseph Boot, Pastor Doug Wilson, Pastor Aaron Rock, Pastor Alex Klusterman, our conversation with Dr. Robert Malone, and all the others who were a part of our 350th anniversary and farewell episode to Andrew. You'll have to become a subscriber over at our Substack. But for this interview that Andrew had with Dr. McCullough, you get to see it in its entirety. So we wanted to bless you with this in the new year, and we want to say stay tuned to the channel as we have more content coming in the new year, because we really entered the new year with a literal bang. So there's lots to talk about, and it's really, really, really important stuff, geopolitical stuff that actually gets into the meat and potatoes of what Andrew and I have been talking about for a long time. So stay tuned to the channel. We'll have more coming for you in the new year, but enjoy this conversation, this full conversation with Dr. Peter McCullough, friend of the show.
Well, friends, it truly is quite the treat and the privilege and the honor to have with me on this very special 350th episode of Liberty Dispatch, former guest, friend of the show, Dr. Peter McCullough. Dr. McCullough is an internist, cardiologist, and epidemiologist, and he's been managing the cardiovascular complications of both viral infections and the injuries developed after the COVID-19 injections. He has dozens of peer-reviewed publications on the infection and has commented extensively on the medical response to the COVID-19 crisis in The Hill, America Out Loud, and on Fox News. Dr. McCullough has testified in the U.S. Senate Committee on Homeland Security and Governmental Affairs, the Texas Senate Committee on Health and Human Services, the Colorado General Assembly, the New Hampshire Senate, the Pennsylvania Senate, and South Carolina Senate concerning many aspects of the pandemic response. Dr. McCullough co-moderated and testified in the U.S. Senate panel COVID-19, A Second Opinion, chaired by Senator Ron Johnson. Dr. McCullough has reviewed thousands of reports, participated in scientific congresses, group discussions, press releases, and has been considered among the world's experts on COVID-19. That's certainly how we have presented him, and I think accurately so on our show. He has many times been a voice crying out in the wilderness concerning COVID madness, and continues to be, in my opinion. And I have been personally grateful for his work over these last number of years. Dr. McCullough, it really is a pleasure. Thank you so much for joining me on. So this is our 350th episode. This is also my last episode with the Dispatch as I'm moving on to other things. So it is truly a pleasure that you would take some time and discuss with me what you're doing and what's going on. So thank you so much.
Well, it's an honor to be on your 350th show. You know, that's a lot of truth bombs. And we're going to drop some more today. So let's get going.
So our most viewed show in the history of our show, which has been going on for almost 4 years, is the interview that Matt and I had with you where we were responding to Dr. Neely Kaplan-Myrth. She's a doctor in Ottawa that still to this day continues to wear an N95 and has self-admitted to receiving her 10th booster.
Oh, no.
And quite recently, Matt and I covered she had to have a hysterectomy because of ovarian cancer that developed postmenopausal. So that is our most viewed episode with you. And I think for good reason. You've been, for many, many people in the last several years, many times a lone voice of reason, cutting through the noise and bringing a measured and thoroughly scientific statistical, analytical response, and I've appreciated that about you. And I mean, Matt and I on the last couple of years have continued to cover studies with your names on them as you are a part of these peer-reviewed studies examining the effects of the jabs, the ongoing effects of some of this madness. So I want to talk, and we were talking off air about the ACIP meeting that's going on and some of the, like you said, some of the real truth bombs that we need to delve into. Before we get into some of that, and I want to, maybe you can update us and say, like we've said, even though the real COVID era pandemic is behind us, the long-reaching effects of what we did, our policies and the jab, we might be sorting through this for years and years and years to come. So in the last couple of years, what have been some of the real important studies or findings that you have found regarding the COVID policy, specifically the jabs, that we want to draw attention to our audience to say, we are certainly not out of the woods and we need to be hyper vigilant so we don't repeat what we did in 2020?
Well, that's a loaded question. And let's just take the aspects of the pandemic before the vaccine. So what we now understand is that the number of deaths in every country was grossly overstated. So test positive, death at any time with no adjudication. National Center for Health Statistics in the United States showed at least half of our deaths, there was no pneumonia on the chart. So it was just potentially just a false positive or test or just an unrelated issue. When adjudication is applied, my estimate is about 10% of the U.S. deaths. The Italians think it's only 3% of the deaths are truly due to COVID. So United States, we're looking at a 1.2 million top line case fatalities. We're looking at 120,000 Americans dying of COVID. Now, that's a big number, but a bad flu season could be 70,000. So that would be the first point. The second point is that of those who died, it's been my testimony that they died because they didn't receive proper early multi-drug treatment like the McCullough protocol, which is the most widely used multi-drug protocol in the world. It's been credited with saving tens of millions of lives, sparing hundreds of millions of hospitalizations. McCullough protocol, published in the American Journal of Medicine and in Reviews in Cardiovascular Medicine. It was the protocol adopted by the Association of American Physicians and Surgeons. So we had this from the very beginning if the government wouldn't have gotten out of the way. But the problem is governments all over the world stepped in and they blocked early treatment. People died. We know that from the lockdowns, social distancing, all the harm that was done there. In the United States, 60% of the businesses never came back. The kids lost a year or more of school. There are all kinds of sociological studies indicating that this is going to have a long-term set of repercussions. And then we move into the vaccines. This has been an absolute tragedy. In the United States, 81% of Americans took at least one shot. And in Canada, I think the numbers are far higher.
It's like 95 to 97% took the first shot, and the second shot was still fairly high. It was just under 90%, very high percentages.
There you go, much higher. United States, second shot was 70%. One booster was at 15%. Currently, United States, a normal person like you and I, we'd be on booster number 7. CDC's not reporting this anymore, but I think it's way less than 1%. Immunocompromised would be at shot number 10. This is unprecedented to give the synthetic genetic code, which is Pfizer and Moderna, coding for a lethal protein developed in a biosecurity lab in Wuhan, China. That's what the vaccines are. Mm-hmm. This is a horrendous thought that people took this into their body. There's no way of breaking down the messenger RNA and getting rid of it. The spike protein doesn't have any human enzymatic route of clearance. We've made some progress there in our research. But this is astonishing as we sit here today. So as I testified in the U.S. Congress about a year and a half ago, I told my congressional panel that I estimate there's 5 to 15 years of consequences from when people took the last shot. So, most people, if they took them in 2021. Some took them later. Unfortunately, the doctor you presented, she took 10. That means she took them right out into this year, and now she's suffering one of the complications, what's aptly termed turbo cancer.
Yeah, and that's it's astonishing to me that we still see and will continue to see. We're just looking at a study. Matt and I were covering a study a few episodes ago, clearly showing the delayed development of children in terms of their ability to read and speaking, that they're well behind. You mentioned the businesses. I mean, what was done in the world and to our countries was astonishing. And we're going to be sorting through, because the consequences of having your business taken from you, right? You worked 30 years to save up to start a business that was taken from you. Your life savings is gone. Your business is gone. This plunges you into substance abuse and deep depression, which then in turn affects the way that you are with your wife and your kids. And so this is a multi-generational problem that will take years and years, long after you and I are gone. We're still going to be sorting through the long-reaching effects of these, and it is very sad. So, in your estimation, as someone who very early on was seeing what was going on and seeing, like you said, that there are responses that are measured and reasonable that we're not taking. So we see this early on. We understand some of the plays that were made. In your estimation, what would you offer to people as a way of encouraging them to say, lest we fall victim to something like this again in the near future, whether it's another pandemic or whether it's, at least in Canada, our federal government has referred to climate change as the greatest public health crisis of human history. It's an existential threat. So whether it's climate change or another pandemic or whatever the case may be, what would you tell people? What do they need to be aware of and looking out for at this point so that they don't get duped again? Because many, I think, well-meaning people gave into fear and pressure and ignorance, and then they did something that they regret, and now they have to deal with the consequences. How can we, on the front end, tell people you have to be watching for these things so you don't fall victim again to whatever's next coming out of the pipe?
Yeah, I think Elon Musk was, he hit the nail on the head when he said what's spreading around is a woke mind virus. I don't know if you remember when he said that. But, the World Health Organization says one of the greatest threats to human health is what they call misinformation. So the first thing I would alert people to understand is we're in a new era. We're in a war of words, if you will. And clearly propaganda is in the open. It's operating in the open. And so what propaganda is when one person or organization wants to gain leverage over someone else. They want to force their opinions or their methods or their way of living onto somebody else. And so there are 6 propaganda terms that now I think as soon as we hear them, we need to reject them. I don't think we should say them or engage with it, but we should recognize what people are doing. Misinformation, disinformation, malinformation, anti-vaxxer, anti-science, and conspiracy theorist. All of those terms are terms that I don't think we should use. They certainly don't belong in medical science, but now in 2021, misinformation became a National Library of Medicine mesh term, a search term. And there are misinformation indices that have been developed. So you could be examined or judged based on this indice and then be declared that you have some mental problem. This is a slippery slope. I reject all of that. I think anytime you hear that, people should understand that propaganda is occurring. Now, you hear those terms a lot more on mainstream media, a lot less on independent media. So people have learned, listen, I've got to do their own research. You can't go on mainstream media and have people slandering one another by using the term misinformation. Go to independent media, start talking about the studies like we're doing here. And then people need to see things for their own eyes. If they're told something, boy, you better be able to verify it with your own eyes. Because I think in many ways all over the world, there's a deception manifesto going on. And, for a while, I was the chief of cardiology at the University of Missouri. Missouri is right in the middle of the country. It's got a great mantra. It's called the show me state. Like I would have to see it. So I have to see things for myself before I buy into it. I'm just because somebody shows me an image on social media or someone tells me that something is going on in the world, if I can't verify it, then I'm going to be skeptical. And I think that's the way we have to be right now. When this pandemic came through and people looked around and it didn't seem too bad and things violated their common sense, like go out and get fresh air and go jogging, or up where you guys are, go play hockey out on the ice. We were told we can't do that. That violated our common sense, and we have to return to these fundamental, tenets that we ourselves are competent in interpreting what's going on and making our own decisions. We don't need the government or anyone else to make those decisions for us.
So how do we walk that line of what I would refer to a measured, informed skepticism, which I think is good. I think it's good. I mean, certainly the framers of your American Constitution had a wise distrust of people in the highest positions of power because they understood human nature, right? They understood, as even the fathers of Confederation in Canada understood, that human beings left to their own devices and with given enough power will ultimately have a proclivity towards sin. There's a sin nature. There's a corruption within us. There's no inherent goodness. I have kids. I see it in my twins. They're wonderful. They're lovely, but I didn't have to teach them how to steal toys and slap one another. They certainly didn't observe that behavior. So there's a good kind of distrust we should have. But there's also been a rise, and I'm sure you've seen it as well. There's been a rise of what I've called an unhinged skepticism, which is we can't trust anyone. So there would be people, for example, who would say of someone like yourself, simply because he swims in the medical industrial complex waters, because he is a man of science and because he is a medical professional, I don't trust any of them. And we can't take that position. That's an untenable position. We need to have some grounding. So how do you recommend, or what would you suggest as a way for us to walk that line well, where we do have a measured distrust and skepticism, where we need to do our own work and research? I think we were told, only a wacko would do their own research. We need to reject that. But at the same time, we need to be able to say there are things we can trust, there are things we do know, and we can't become totally untethered in our skepticism. Help our audience. I mean, you're a man of science, you're a man of logic and reason. How do we thread that needle and not fall into either of those ditches?
Oh, I think that's a great, it's a great analysis and question that follows. Skepticism is healthy. Discussion is healthy. And I think we have to, use our sense of prudence. What's reasonable. You could say, well, I don't, completely trust the police. Okay. But you can't say, well, listen, I don't trust the police, so therefore I'm going to violate every law and drive 200 miles an hour down the freeway. And you just can't, lose your gourd over these things. I've heard people say, listen, the doctors encourage these vaccines which cause fatal complications. So therefore, I don't trust doctors at all. And, you get appendicitis and say, no, I don't trust doctors. I'm not going to have surgery. And you can die of appendicitis. So we're going to have to use some prudence. I think doctors were completely wrong on the COVID-19 vaccines. I think, a reasonable amount of medicine is still there, but always, trust but verify. But I've had people, in this health freedom movement, they in a sense are kind of they go nuts. They say, well, they say, listen, I don't trust any medication. So let me just give you a breakdown there. There's been some very good studies done, certainly in my field in cardiology, but in general medicine. When you get to age 65, about 10% of people are on no prescription medicine. It's possible to get to 65 requiring no medicine. It's possible. I always tell people, go for it. If you think you're in the top 10%, go for it. But if you see somebody who doesn't exercise, they got a big pot belly, they got a family history of diabetes and high blood pressure, whatever, they smoke, the chances of them getting to 65 requiring no medicines is about zero. I mean, you really have to be, you have to be a superstar to make it in that 10%. So everybody needs some medicinal help if they want a long lifespan. So a lot of people say, listen, I just want to take vitamins and supplements, and I want to live to 100 with no medical problems at all. I said, well, I would like that too, but it's just not going to be possible with my genetics. My genetics have called for me to have high blood pressure, and virtually every man in my family was dead in their 40s due to heart failure or stroke. Before the era of modern medicine, it was due to untreated hypertension. My wife, her mother, they have low thyroid, hypothyroidism. So my wife would be miserable without a prescription thyroid medication. So here we go. There's nobody in my family that's in that zero medicine category. So I just want people to look at this rationally and also be skeptical of things that we've relied on for decades and decades and decades. When people say, oh, suddenly they don't work. It's like, So for instance, I've heard in my field, I'm a cardiologist, I've heard people in the health freedom movement say, listen, cholesterol doesn't cause coronary heart disease. Based on what? Based on just because, that's a wishful thinking? And I've heard this. I said, listen, I've been in the cardiac pathology lab for years. When we slice the coronary artery open, particularly in young people, when it's blocked, there's cholesterol right in the arteries, blocking the arteries. It's right there. We can kind of squeeze it out. It's right there. When we lower cholesterol by any mechanism, we reduce the rates of heart attack and stroke. So people say, well, I don't want to take statins. Well, you could take one of 6 other drugs that lower cholesterol, but the principle is lowering cholesterol. Oh, okay. Or I'll tell people, listen, you don't have to take a statin, but you do have to be willing to take the risk of having a heart attack or needing stents. So it's your choice. I mean, it's a free world. Nobody has to take statins. I think the best way of handling is what the UK is doing. Just make them over the counter and tell people, listen, it's your choice. It's a health choice that you can make. And I prescribe statins all day long. It's not a big deal. About 15% of people can't take them because of muscle aches. There's many side benefits. 31 studies, prospective randomized studies show they reduce the rates of dementia. Just the opposite of what a lot of health freedom wingnecks think. And so we can go on and on. So the basic principles of medicine are, solid. Medicine, and I wrote a book on this, vaccines, mythology, ideology, and reality. This is a bad part of medicine, vaccines. And we found that out with the COVID pandemic. This is an area where the medical orthodoxy is wrong. I gave a Chautauqua lecture this year earlier, and there's 2 other major areas where medicine was wrong in history. One was cocaine. In 1860 to 1920, every major drug company product and everything the doctors prescribed for patients was derivatives of cocaine. That was a disaster. Everyone got addicted. And then smoking, 1920, 1978. Virtually every doctor smoked. They gave out cigarettes in the office. The tobacco companies marketed the doctors and nurses. They were wrong. They were wrong on cocaine and wrong on smoking, and they're wrong on vaccines. And in our book, Vaccines, Mythology, Ideology, and Reality, we go over this. It's basically a field of medicine that has made bold, unsupported claims. It operates off of fear of infectious diseases and asks people to take shots based on faith, based on an ideology. Now, there is some reality. Some vaccines have done some good in terms of dropping case counts, but many now, the big area in health freedom is to question this vaccine narrative because, the COVID vaccine campaign ripped the Band-Aid off this.
Right. And that leads to the distrust factor. It's what else had they been lying to us about? And I appreciate the encouragement to exercise prudence and just slow down for a moment. I mean, there's a movement, for example, especially among maybe people a half a generation younger than me that are insistent on we will do home births. We're only going to do home births, which I don't disparage at all. I don't think there's anything to say, oh, that's, hippie. No, not at all. But I think about our particular situation. Our firstborn, he was breech. He was then flipped with an ECV. But in the process of flipping him with an ECV, we didn't realize that the umbilical cord was then wrapping around his neck in a way that we didn't see. So when we were in the hospital. So when my wife was delivering him, he wasn't coming out so easy because every time she would push, the cord would pull him back in and his pulse would go up. His heart rate would go up. So eventually they get the vacuum, they pull him out, and then they see the cords around his neck. Now, the reality is that if we attempted to have a birth at home, he would have died, and maybe my wife as well. And so I can't say, oh, well, home birth good, hospital bad. Don't ever do birth at the hospital. That's a silly position. I think that's as an absolute, it's only this or only this. But we need to be mindful of the fact that there are good doctors and good research and good medicine, and we can't just throw the whole thing out. That's a very dangerous position.
And there's also wise parents. I'm really glad you brought up that vignette because I had a very similar experience. Our first child, our daughter, was in the hospital. My wife was in the hospital. Same thing, cord wrapped around the neck, couldn't see it by ultrasound, and started having what's called fetal decelerations. That's actually not enough oxygen to the brain. And if this would have been a home birth, again, it could have led to fetal demise or maternal demise, but more likely you would have ended up with a severely mentally retarded or cerebral palsy child. That's what you would have ended up with because the brain doesn't get enough oxygen. And, my daughter's 30 now. She's wonderful, intelligent. She's an attorney. She's beautiful. And that is a product of modern obstetrics. This is very important. Modern obstetrics has made big strides. So people are going to have a discernment of what's legitimate, what's not. Follow what's going on. Recent development back in the vaccines area. I think everybody is having a lot of distrust in vaccines. It just happened today is in the United States, we followed Canada. In that we've dropped universal hepatitis B vaccine on the first day of life in the hospital. Canada allows choice on this. The United States did not allow choice. And you know where this came from? This is interesting. This is out on Focal Point Substack today. In an op-ed in New York Times in 1991, when universal hepatitis B vaccination started, the public health officials were quoted as saying, listen, the people who are spreading hepatitis B are largely IV drug abusers and prostitutes. But since we can't get them to come into the clinic and get vaccination, we're going to vaccinate all the babies instead. That's where this came from.
Yeah, and I know, for example, I think it's the vitamin K shot that is given to children right after they're born. If I might be mistaken, but my understanding is that is given at a time where if a mother had gonorrhea and then is giving birth to the child is a way to deal with that, where you think, well, how often does that happen anymore? Or
it's a little bit different. The vitamin K is actually to try to, in a sense, thicken the blood and the risk of bleeding. And it was started with premature babies delivered before age 37 weeks, where there can be a spontaneous hemorrhage into the brain. So the thought is, well, give them vitamin K. Well, the study showed, unfortunately, it doesn't stop the spontaneous intraventricular hemorrhage. Then people have said, well, the blood clotting factors are not well formed, so maybe this would reduce the bleeding with circumcision in boys. But the point is, the argument to give a vitamin K shot on the first day of life is just not compelling. And what a lot of parents are doing, whether it's a home birth or a hospital birth, is they're just going natural. They're simply telling the doctor, listen, I just deliver the baby, deliver the placenta. If there's an episiotomy, close that up, proper intravenous fluids and good sterile hygiene, deliver the baby and just give the baby to the mother. No needles. Just the needles hurt. And a leading cause of fever in a newborn baby is actually getting a hepatitis B shot. And then we have to do blood cultures and urine cultures and spinal taps. All that's unnecessary. Just deliver the baby and give the baby to the mother after proper suctioning and delivery of the placenta. And I think what we're going to do is get back to some natural aspects here. Every baby getting a vitamin K shot and every baby getting hepatitis B shot. You were mentioning a form of an ointment that's put in the eye actually for a chlamydial
That's what yes,
infection.
Right. That's right. The stuff, the goop on the eyes. You're right. That's
right. But
that's what it is. Yep.
Yeah, but women are screened for these infectious diseases. Right. So cervical gonorrhea or chlamydia, and just a healthy, normal woman, normal man, delivering in suburban Toronto, Alberta, Edmonton, or Dallas. None of that stuff applies, and we screen for it anyway.
Yep.
All we want is a normal, natural, safe delivery.
By Rocklinc Investment Partners. Protect your investments and ensure they align with your principles. Rocklinc Investment Partners are committed to guiding Christians in building a secure financial future while investing in harmony with their faith and biblical stewardship. Reach out to Rocklinc at 905-631-5462 or email them at info@rocklinc.com. That is Rocklinc with a C.
So I want you to drop some truth bombs on us. We were talking about that before we started recording. But before that, I just have a simple question. I thought about it when you were in your response. It was the second point. Where would you recommend? What would be some really good sources of information, alternative media, or where would you direct people? It doesn't have to be very many, but whether it's where they're getting their particular health information, medical information, whether it's certain, obviously your own. I subscribe to your own. I'm following you, Dr. Malone as well. So, Vaccine Choice Canada, certain Substacks, or even certain sites that examine peer-reviewed studies or certain news sites. Where would you tell people, here's a good place to start if what you want to get is a more honest, unbiased, not woke, statist view of what's happening in the medical world?
Yeah, I would say in the medical world, for sure, focal points. So if you go to thefocalpoints.com or get inside Substack and search focal points, that's the leading one. So that has the most evidence, most scientific citations, publications, and it's straight up. There's 3,000 articles posted there. That's straight up. I was going to say another really good one is over in the UK, and that's the World Council for Health. World Council for Health. And that one is a lot of doctors across the United States and Europe, UK. And they have actually briefs and they have guidance documents. And one of the guidance documents a lot of parents rely on is what's called the Safer to Wait guidance, which is, physician-led, evidence-based, consensus-driven, and says that a healthy child born today, it's safer to wait on all these vaccines. And so if vaccines are given later in life, they're far safer than blasting the baby, on the first day of life. Or in the United States, they actually start getting it on, I think, the 2-month baby visit in the office. Most of the pediatric visits for a healthy child, they're just getting blasted with vaccines. And Safer to Wait says, listen, safer to wait for sure out to age 4, maybe beyond that, so we don't have any complications.
Mm-hmm. So you mentioned that I have a brief anecdote I want to share before you hit us with what's happening with ACIP and some of the revelations, some of the stuff that's important to know. Our firstborn son, we brought him in for his first set of shots. So this would be about 13 years ago now. We brought him in for his first set of shots, and then he responded very strongly. So blood in the stool, kind of wrenching in his stomach, like tight abdomen. So we thought, okay. So it went away eventually. And then after that first shot, we'd found that he responded the same way whenever my wife would eat dairy. So we decided to curb her diet. We cut out all the things, the dairy, and then we cut out cauliflower, all the colicky stuff, broccoli, all the garlic. We cut it all out. Then we started slowly reintroducing things, and we found that everything was fine. Then we introduced dairy, and he had the same response. So we zeroed in, that's probably what's going on. So then the very next appointment where he was scheduled to get more shots, I told our doctor, the way he responded initially to the shots is the same way he responds to dairy. Do you know about any allergens in these particular, and it might have been the MMR, it might have been a big one. Do you know if there's any allergens? And our family doctor said, no, I'm not sure. So she proceeded to get the little box. It was this big. And then give me the instructions, which was basically like folding out a map of the world when it was all opened up. And I'm reading through hundreds of ingredients. I'm like, bovine serum? That doesn't sound good. So I'm reading through, and then I get to the end, and I don't read. So I learned that it's, casein, whey, these are milk proteins. It's not just lactose. So I get to the end, and in the end of the sheet of paper, it says, for the full list of ingredients, please go to this website. So I pulled up my phone and I went to that website, and there was another several hundred. And as I'm scrolling and searching, then I find casein and whey and dairy proteins inside. And so we tell our doctor, we're just going to hold off. He had such a strong response the first time. He'll be okay. Let's just wait. And then we ended up postponing and pushing, and it reached a point where we said, I think we're just going to take him off the schedule. I don't think we need to keep doing this. But I found myself saying, as a medical professional, I understand what's going on. She's just told they're safe and effective, put them in the kids. And so she's doing it. But you have to, allergens, for example, key allergens like dairy, eggs, and like you would think it would be good to know, hey, here are some ways that if your child has these allergies, they might respond strongly. And we never got that. That was one of our first signs of how ultimately trustworthy, like we're putting the safety and well-being of our newborn in the hands of someone who's not really thinking about these things. That's where some of the questioning began for us at that very early stage of something doesn't seem right here.
Yeah, well, listen, good parental instincts pay off every time. Do you know that allergic diseases have skyrocketed in children? I'm talking asthma, allergic dermatitis, food allergies. When I was a kid, we used to eat peanut butter and jelly sandwiches. You'd go on Southwest Airlines, they gave peanuts. Now you'd never have a peanut in an elementary school or on the airplane. So peanut allergies have just skyrocketed, nut allergies in general. There was actually a paper from Canada showing year by year the number of paramedic calls for life-threatening nut allergies. And it's astronomical. I mean, it just keeps going up and up. What happens is the immune system is developing early in life. And if we've learned anything, we probably shouldn't be perturbing it in this early stage. If you naturally encounter a virus or a bacteria or another antigen, fine. But to inject it in the body is causing all kinds of severe problems. And so 12 studies now show if a child goes natural, has no vaccines whatsoever. So this would apply to your child. If your child had no vaccines whatsoever, chances are wouldn't have developed this, what I call a polyallergic picture. Now, the vignette that you gave is, I think, very worrisome for what's called intussusception. When you first explained this, severe abdominal pain, cramping, and really tight and bloody stool. And that's intussusception was why one of the vaccines was pulled off the market, the rotavirus vaccine. So it directly causes that syndrome. But you're right, the vaccines are too antigenic. And I wrote a Substack on this. I was curious about peanut allergies. And it turns out that there's shark liver oil. That's a predominant ingredient. You probably read that in the first thing you read. That probably has some homology to peanut allergens, and that's what's going on. So, I wondered today how many kids with allergies, taking allergy shots, on asthma inhalers, etc., how many of these kids actually have food allergies? Kids who have all kinds of problems with peanuts and nuts and milk proteins and egg proteins and whey and the gluten. I wonder how much of all that is due to vaccination.
So hit us with the goods, Dr. McCullough.
Okay.
I want to know more. I know I was actually chatting with Dr. Malone, and we did reschedule with him. He's also going to be on this episode, but we had to reschedule specifically because of the hearings and the timing that didn't work out. So give us what's going on. Some of the big bombs, the big revelations, like what's happening, what's been revealed, what's been shared and presented, that in your estimation, these are the things that we need to know about, we need to be informed about, we need to make informed decisions. Just drop those bombs.
Well, here we are now. So as of today, the time of this recording, United States Advisory Committee on Immunization Practices has dropped the universal recommendation for hepatitis B vaccine on the first day of life. So very important. I was on Fox Business last night, national prime time, and I was telling Americans it's simply not needed. We have 3.6 million live births. Only 25% of the mothers have hepatitis B, and we test for it in everybody. There's universal testing. So the women who have hepatitis B or are carrying it, the babies need the vaccine on the first day of life. That's 25,000 babies. That's fine. But all the 3.6 million healthy American babies skip the hepatitis B vaccine. And it's far more appropriate when you get later in life, either at the time of sexual contact, or I think more importantly, nurses, doctors, first responders should get it as they enter, their field. That's when I took the hepatitis B vaccine. Far safer to take it as an adult. So that's a big piece of news. Canada, it's been that way for a while. Now, another big piece of news is McCullough Foundation published a report. And McCullough Foundation is supported actually by donations from Canadians, Americans, and other very important. I'm in the studio today. McCullough Foundation published this report entitled The Determinants of Autism Spectrum Disorder. Now, this is the most compelling, scientifically assembled document on explaining the autism crisis. Autism, when I was a kid, was 1 in 10,000. Now it's 1 in 31. 3.2% of American children have it. 25% of them have profound autism, which is a disaster. They're just severely mentally incapacitated. And what we've concluded in this report is that childhood vaccination, given in big combinations at these visits, is a risk factor for the development of autism spectrum disorder in susceptible children. And what can make them susceptible is being a preemie baby born before 37 weeks, parents older, progeny of older parents, some common genetic variants, and maybe some exposures during pregnancy, like prolonged antipsychotic or anti-epileptic or antidepressant use during pregnancy. Not Tylenol or acetaminophen. That fell out of the analysis. But this bundle of vaccines is greatly worrisome. We sent our report to the U.S. HHS, CDC, Robert F. Kennedy, the entire team. We published it on the European Commission Open Air Zenodo server. It's already had 250,000 reads and downloads, which is unprecedented. A typical scientific paper gets about 250 or so. And within 3 weeks of our press release on October 27th, 2025, our CDC quietly overnight changed its statements on its website. And they said, the prior studies that said there was no link between vaccines and autism, they were wrong. And the CDC has now vowed to do its own report. I've publicly encouraged them to do that. The CDC has 12,000 doctors and scientists. They've got a $9 billion budget. And over decades, they couldn't do a report like the McCullough Foundation report. This is absolutely shocking. In fact, I'd say it's shameful.
Yeah.
And this report has been covered by virtually every major media outlet, and we haven't had a single credible scientific attack. There's been a few ad hominem attacks. I was contacted by CBS News, and the questions were clearly ad hominem attacks. And I simply posted the questions and the responses and gave some information about CBS and the reporter. And I did it on focal points. And I sent it back to her. Her name is Dr. Grounder. I said, Dr. Grounder, here it is. You feel free to use any of these responses and the digital assets in your piece. Guess what? no response. No response. And so that's the new normal now. So when we get antagonistic interviews, I've had one from the Washington Post, Bloomberg. We record them or we publish them and we put them out on focal points so you can see the interaction. So we will not be defamed. We won't be misquoted. And
so how long? Hearing you say that, it brings back the memories of the last 6 years, right? So a number of ways. I know, for example, and again, there was no fanfare. Lots of fanfare about safe and effective. Lots of fanfare about masks. Lots of fanfare about misinformation. But when the CDC and the FDA quietly mentioned hydroxychloroquine as now being a proper preventative prophylactic, they didn't tell us that. They made sure to tell us don't eat the horse paste. But when they eventually had to add, I remember we covered this as well, when the CDC now had it, and Health Canada was the same thing. They're saying it's bad, it's going to kill you. And then all of a sudden they're like, you know what, maybe it's actually something good to you. So lots of silence, but just whenever you present studies and evidence, like the way Dr. Scott Atlas, for example, was treated by the COVID task force for simply saying, let's examine these studies together, rather than an honest, scientifically rigorous response. Like you said, it's ad hominems, it's vitriol, and it's not actually engaging well with the information. How long, in your estimate, it's tough to know, but how long do you think we don't have the clear connections definitively to show that the prevalence and really the exponential increase of the amount of medication we're putting in kids from an early age, we don't actually have the evidence to say definitively it isn't linked to autism spectrum disorder? How clearly this has not been 5 months or 5 days. Clearly there's been that lack of evidence for a while. How long has this been suppressed, or how long has it been the case that they've maybe even been aware and said, yeah, but let's not actually broadcast that. Let's kind of pull it back, in the same way that they were well aware that the masks didn't work, and aware that transmission wasn't being curbed, but we were told differently anyways from the legacy media. How long do you think this has been the case that, what is now public hasn't, it's been privately known for a long time?
It's gone on for decades, and the reason why the public health community buries it is they don't want to contribute to vaccine hesitancy. They think if you're hesitant in taking a vaccine, like you and your wife are on your child, they think that is like its own mental disease.
Did you hear what the surgeon, the College of Physicians and Surgeons of Ontario, I don't know if you heard about this. This was a couple of years ago, that the College of Physicians and Surgeons in Ontario they instructed doctors in Ontario that if one of your patients says they don't want to take the COVID shot, or they display vaccine hesitancy, that the solution might be either psychotherapy or some sort of medication to deal with their...
Oh my gosh.
I know. So So the college told doctors that if your patient says, I don't think I want to get the COVID shot, maybe psychotherapy, maybe some sort of medication to deal with their mental illness. This is how doctors in Ontario were directed by the college.
I'm glad you brought that up, because that's how far it's gone. Vaccinology is like a religious faith. And so if you're hesitant, that means you're apostate. And so that's the reason why there's so much fervor around this. There's 20 different instruments, psychometric instruments or surveys that try to probe and see if you're vaccine hesitant. But listen, the literature out there and the concerns on autism, they go back to Leo Kanner, the child psychiatrist who originally described autism. And he describes 11 children. One of them developed it right after receiving the polio vaccine. It's right there. And this goes all the way forward. The big explosion in vaccines happened in the United States in the 1986 Vaccine Injury Compensation Act. And the companies knew at that point in time it was a bonanza that they could not be sued for any more vaccine problems. Previously, the diphtheria vaccine and the pertussis vaccines, oh my Lord, they were just generating so many lawsuits. So what the U.S. government said is it said, listen, if there's a vaccine injury, and in the legislation, it says there will be injuries. There's unavoidable harm with vaccines. You can get this compensation. So, after the legislation's passed, this class of claimants came forward and said, listen, my child's been injured by the vaccine. So they picked what's called some bellwether cases. And one of the bellwether cases was Hannah Poling. That's her name. So as a little girl, she got behind on her vaccines because of scheduling problems. Her father is Jonathan Poling. And he's a neurologist at Johns Hopkins. Very important. So this guy knows what he's talking about. His daughter takes a big bundle of vaccines, and within a few weeks or months, she clearly regresses and develops autism. We actually have a chapter in our book on this in the U.S. Court of Claims. So Poling makes all these careful observations, and he even comes up with some ideas about why his daughter could be predisposed for this potentially even genetically. But it's clear the vaccines triggered the autism. He publishes a peer-reviewed paper, and he submits this with her case to the U.S. Court of Claims. And the U.S. government looks at this and says, you know what? You're right, Dr. Poling. The vaccines did cause autism. And they pull him over to the side and they make a financial deal with him, a settlement, and they settle with him. Then they take the other 5,000 cases and they dismiss him. No, your problems aren't due to the vaccines. This happened. This really happened. And so, in our paper, we consider the Poling case a definitive case vignette. And this has gone on for decades upon decades. And so we're at a point now where parents are clearly backing away from vaccines. In a recent paper by Mawson and colleagues from the Florida Medicaid system, 49,000 Medicaid recipients, children, 10% of that data set has had no visits for vaccines whatsoever, none. And that's one among 12 studies that show a child born today who's healthy at birth remains healthier if they take no vaccines whatsoever.
Yeah, anecdotally, that is certainly the case among not only peers my age. So we're in a unique position where I'm 41 years old, our oldest is 13, and our twins are 2. So we kind of live in two worlds where
I'd say so.
Friends that are our age who have children similar age to our older kids. But then we also have friends who are about 20 years younger than us, whose children are the same age as our twins. And so in both of those age categories, in both the parents who are in their early 20s who are just starting families, or parents who are in their midlife who are also having to really rethink what we do, in both of those cases, anecdotally, there is certainly a questioning and a hesitancy to, in light of what we've learned, do we really want to be putting this inside of our children? Is this the best way to go? And I'm glad for that, actually. I'm glad because it's forcing us to do something that I think is necessary in the days ahead. And I want to ask this question. I want to get your feedback as well. But I think something that is essential for the days ahead in light of what we've been through in the last 6 years in particular, but we can broaden that out to the last 40 or 50 years, is people, I think, in a way like never before, at least in my lifetime, are taking very seriously that they need to be responsible for their own health and well-being and that of their family. And I think they're thinking more seriously about it than I can remember in terms of what we eat, in terms of medication, in terms of vaccines. And I think it's a good thing that people are taking it seriously, and I'm glad for it. And we need to, because the truth is, I mean, if life-saving surgery is required, I was joking about this with someone recently, I'm not going to pull up a YouTube video on how to do brain surgery. That's just not going to happen. So the reality is that's needed. But I would like to have to visit the doctor as little as possible, not because hospitals, are icky, but because I should be able to be responsible about my own health and well-being and that of my family so that we can take care of ourselves. So I think that's part of the way forward, is to be even more responsible and even more informed. What would you offer to our listeners? I think this is a good way for us to kind of land the plane, to say to them, in light of what we've seen, in light of what we've been through in the last half a decade and what we know now, the way forward involves you being serious and you being responsible about, and fill in that blank.
Boy, I think that's a great analysis. People more and more want to be less dependent on doctors. I would say that if you could get away with never seeing a doctor or a lawyer, boy, would life be good. You know what I mean? It's like there's like a certain dread in seeing a lawyer or a doctor. It's just what it is. But in general, someone should have an exam once a year, certainly check blood pressure. I think all the routine cancer screening advice works. I think once a year, people should get a comprehensive blood test. In the United States now, you can order this yourself. You don't need a doctor. You can we have a big lab system called LabCorp, Labs on Demand. You can actually order like a comprehensive health panel. Do it yourself. It's very affordable once a year, and see if anything is out of bounds there. About 70% of diagnoses, by the way, is made from the lab, made from blood testing. 70%. So I think that's reasonable. If you're going to go natural and rely on natural supplements, let's say to lower blood pressure and cholesterol and reduce the risk of diabetes, etc. I would say you probably need about 6 to 8 supplements per day, and the supplements that have multiple ingredients in them. So at the wellness company where I'm the chief scientific officer, every one of our supplements is kind of loaded with kind of multiple ingredients in a single capsule. It's possible to do that. I think a big part of staying healthy from infectious diseases is doing a nasal spray and a throat spray or gargle twice a day. Very important. Don't wait until you get a sore throat. Do it twice a day. The viruses land up in the nose. They percolate there for about 7 days. You never know it. And then you get a sore throat. It's too late. So you have to knock it out every day. A couple squirts up there, sniff it back, spit it out, and gargle. I've already done mine this morning. I'll do it tonight. I tell you, if you want to be free of getting any flu or RSV or COVID or anything else, do it twice a day. Your kids can do it. Even little babies, you can do dilute baby shampoo when they have a bath or a shower and clear out the sinuses. It's perfectly fine. So I would do that. I would say that people should do their own research. In the United States, we have the wellness company. People order medical kits. It's very important. They can pre-order an emergency medical kit and have a bunch of medicines on hand, like antibiotics and pain relievers and other things. And then when something happens, they can follow the guidebook and they can call telemedicine, which is included in the price of the kit, and they can handle their own medical problems. And this happens all the time. My wife was traveling recently, helping my daughter, and she got a thorn from a cactus stuck in her finger, and it quickly got infected. And then she couldn't get it out. Thank goodness we had the emergency medical kit. And she followed the instructions. I guided her through it. And, my wife avoided an ER urgent care visit. In the United States, it would have cost over $1,000. In Canada, you guys are all covered by OHIP and all your provincial plans. But the bottom line is people are taking control of their health. A big part of that is healthy diet, so healthy choices and portion control, running your body weight nice and lean, exercising, both strength and aerobic exercise. That's exactly what I'm going to do when I get off air today. It's a nice Friday here in Dallas, Texas, but I think I've covered it. And, this is going to be, I think, a real capstone on your media career here. It's been great to finish it out with you.
Yeah. So quickly, because I want people to know where they can go, can you hold up the book again, the title, where people can find it? I want to make sure that people know that, because that's an important piece of literature.
Right. So it's literature. So it's not a guide about what vaccines to take or not, but it gives you the evidence. It's Vaccines, Mythology, Ideology, and Reality. It's a New York Times bestseller. It's the only book in this genre that's ever made the big time. And it's written by first author John Leake, who's considered the world's greatest historian currently. He's a brilliant writer. It's a 300-year history. It's character-driven. It's a story, the beginning and a middle and an end. And it lands in this era that we're in now. And sadly, vaccines are now used in what's called the bioweapons era.
Mm-hmm.
Vaccines are considered military countermeasures. That's the reason why the COVID vaccines are called. So we finish up in this book. So go to Amazon or wherever you buy books, get a copy of this for Christmas and the holidays. Give a copy to your doctor. Vaccines, Mythology, Ideology, and Reality. I think it's worth about 3 credit hours for graduate school. It should be. And then any parent who needs the facts on autism right
tell
now,
them where to go.
Go to McCulloughFND.org. McCulloughFND.org. Download the report and take a look at it. It's mission critical to examine your child, look through the tables, and see what you think could have been a factor. This is compelling. This report changed what the CDC did. And support us at McCullough Foundation. Our work is changing public policy now. We have the biggest Twitter accounts. I'm on national TV multiple times per week. And I've learned, you know what? We can influence what happens in public health to a greater degree being outside government than within government.
Mm-hmm. No, that is absolutely true. And I'm glad you mentioned the end of my formal media career, because I couldn't think of very many ways that I would rather spend this last episode than being able to take some time to chat with you. I'm always grateful for you giving us the time. And I said this early on, I'm personally, I remember when the world went crazy back in 2020, and there were a few figures publicly, there were a few people, whether it was various politicians or media figures or medical professionals such as yourself, that served as a grounding for me to make me say, okay, I'm not losing my mind. I'm actually thinking clearly despite what everyone else is saying. And there are other people that are being reasonable and seeing this the right way. And so I have been personally very, very thankful for your work and for your voice, and will continue to be grateful and thankful in the years ahead. So, Dr. McCullough, thank you so much for joining me on this episode of The Dispatch.
Thank you.
Hey there, everybody. We hope you enjoyed this podcast. Be sure to go over to our Substack, ldcanada.substack.com, to check out more wonderful interviews and podcasts like this. Be sure to become a paid subscriber over there so you can, for a very nominal amount a year, become a full access member, and you can get the full interviews that we do with all our various guests. You're not going to want to miss it. But anyways, thank you for tuning in. Happy New Year. We hope you all had a Merry Christmas, and we will see you soon. And it's for freedom that Christ has set you free. Stand firm, therefore, and do not submit again to a yoke of slavery. Till next time.
Liberty Dispatch has been brought to you by SDG Media. If you want to stay in touch with us on all things Liberty Dispatch, join our email list, or support the show, head over to ldcanada.substack.com.